Welcome everyone to today's Upper Midwest Telehealth Resource Center virtual office hours. We are very happy to have our colleague Allie Orwig with us today. As you can see from our title slide, Allie is one of our senior directors here at the Indiana Rural Health Association, which is the umbrella organization that hosts the Upper Midwest Telehealth Resource Center program. And I am Becky Sanders, director of the UMTRC. So today we're going to be talking about broadband resources, and all month we're going to be talking about broadband resources. Today we're focusing on resources that are available on our website and other websites that are specifically focused on providers, and we're going to give you a tiny little tidbit of a couple of things that are coming for consumers that you might want to be aware of. And then you can come back later in the month on the 29th from 12 to 12:30 Eastern, and we'll be talking all about consumer broadband resources. So I've got just a couple of slides here to introduce you to the UMTRC if you're not familiar with us. We represent the LILAC states here, so we cover the states of Indiana, Illinois, Michigan, and Ohio, so 4 states, and we are known as a regional telehealth resource center. The other areas of the map of the United States and the Pacific Basin have different colors. There's a different regional telehealth resource center for each region, and then we have 2 national centers, one for policy and one for technology. And you can reach out to any of the telehealth resource centers through the national map and the national website, which is telehealthresourcecenter.org. We are all federally funded through HRSA, through the Federal Office of Rural Health Policy and the Office of Advancement for Telehealth. Here in our region, I've coined the term virtual librarians, especially through the pandemic with COVID. With COVID, so much of what we do has become virtual. We haven't been able to get out and do presentations at conferences or networking events like we normally would. But a lot of what we do is individual assistance with people who either email us or call us on the phone, and we provide webinars and training sessions, kind of like what we're doing today. A couple of other things that we've started recently with COVID is a virtual view, which is our podcast. We typically publish 2 podcasts each month on the 1st and 3rd Friday of each month. We've been doing these virtual office hours. Also, we've started doing telehealth workshops that do have CME available for physicians, and those happen once a month. We started those in February. We did one in March. The next one here in April is next Friday, the 16th, and then we're working on opening up a demo center as soon as COVID numbers become low enough that we can open that up. It'll be by appointment or as part of training sessions that we hold on site in our Indianapolis, Indiana office. At this point, I'm going to turn things over to Allie because she is our broadband expert. Allie, go ahead and take it away. Let me mute myself first.
Thank you. And thanks for everybody joining us today. I'm going to move pretty quickly along through this presentation to hopefully give time for questions at the end. But this first slide is just talking quite a bit about how important broadband is in rural. So I don't know if we have any rural attendees today, but if you're not familiar with rural life, you may not be thinking about just how important it is to have a good speed that is reliable for your internet connection. That's for things like working from home. Obviously, this last year has taught us all how important it is to be able to have the capacity to work from home. Agriculture is another one that people don't often think about, but with precision ag growing all the time, that's things like self-driving tractors, using drones to specifically track your fields and be very precise about application of chemicals or watering. That is just absolutely booming. Of course, along with work from home, education has become something that we've all learned a lot about doing online in the last year, especially if you've got kiddos at your house. Entertainment, we've all been doing Hulu and Netflix and Peacock and Amazon, and I can go on and on and on. The number of entertainment options just keep growing all the time, not to mention online gaming, things like that. And you have to have a pretty decent speed and certainly reliability for those items. Religion, again, COVID has really just taught us how important all of the strong, reliable connections are, because many church services this last year have gone online. I know my husband and I were able to attend our brand new niece, who we've not even been able to meet, but we were able to attend her christening online in Wisconsin. So just some really neat opportunities there. And then, of course, we all know about shopping, Amazon, eBay, etc. It sounds like a luxury sometimes, but in rural areas, it truly can be the only option for certain people, especially if transportation is any kind of issue. If you have to drive 40 minutes just to get to a Walmart, how important can that online shopping that can deliver right to your door be? And then, of course, what we're really here to talk about primarily is healthcare. And I kind of broke it out into two different phrases. There are a lot of different definitions of telehealth and telemedicine, but this is the way I tend to think about it. So telehealth is a very broad umbrella. It can be things like fitness, doing different classes online, or tracking your water intake. Different kinds of or steps even. We've all got our Fitbits and our Apple Watches. Remote monitoring, that can be things like people with chronic heart failure automatically being able to weigh themselves and upload that to their doctor every day. It's a great thing that we have available, and can really head off a lot of potential problems that are stewing without having to go into the doctor's offices. Electronic health records, of course, would fall under that telehealth. And then even things as simple as getting tips texted to your phone every day. I know I've got a kiddo at home, or she'll be two, but one thing that we could do was sign up for tips for your new baby that were sent to your phone all the time. All of those things and more can fall under that telehealth banner. And then when we talk about telemedicine, it's actually the direct delivery of healthcare. That would be things like doing a stroke intervention program when somebody presents at a local hospital, or being able to use the STEMI gloves in an ambulance to tell if somebody actually needs to go on to a secondary or tertiary facility. Have I lost my ability to control it, Becky? Here we go. Okay, so the barriers are probably not terribly surprising. Geography is a huge one. Location. And this can be anything from physical distance from the most reliable broadband connection, or it can literally be things like the trees are too tall around your home or business, and you cannot access reliable wireless or satellite or even cellular. You might be down in a valley or near mountains. And then another barrier is that many people have some access, but it's just not enough. You can't get the speeds at a reasonable cost that you need to be able to live your life or provide your services, or the reliability may just not be there. Lots of dropping, lots of interrupted services, a lot of downtime. And then, of course, the biggest barrier, which really could solve number one and number two, is cost. Because right now the construction of fiber runs between $25,000 and $40,000 a mile. Costs are coming down, but depending on where you are, whether you need right of way, etc., it can get rather expensive. I don't know why I've lost control I'll just have to say next slide, Beck. So here are some programs to help with that third barrier, the cost, which is often the biggest barrier for most people. The first one I'll talk about, and most of these come from the federal government through the FCC, administered by USAC, Universal Service Administrative Corporation company. Though not all of them, I'll talk about a couple others as we move on here. But the telecom program is the first one. It is specifically for telecom and also voice services. And the reimbursement rate on that is based on the urban-rural differential. So that's how it is determined how much percentage off your bill, essentially, you would be able to qualify for. The second is more, well, the second and third are more focused on the end users. So you've got the Lifeline program, and the rules for the emergency broadband benefits are very much mirror the Lifeline program. It's kind of Lifeline on steroids. So the Lifeline program provides up to $9.25 a month for, it can be wire or wireless telephone services, so cell phone or wired in phone lines. And it's up to $34.25 for tribal lands. And to qualify, you have to be at or below 135% of the poverty line, or you can also be eligible for these programs by participating in things like SNAP, being a Pell Grant recipient. So 135% of the poverty line or qualifying for other certain programs. And then the emergency broadband benefits, or EBB, is essentially the exact same thing, but much more funding, because they have realized how important these connections are during COVID. And that's up to $50 a month or $75 a month for tribal areas. And there's also built into the EBB a potential one-time $100 bonus, if you will, to purchase a device if you need a device as well. So that could be a phone, an iPad, a laptop, but it's only $100. So you would want to be judicious. The next one is E-rate. E-rate is really the mirror or sister program of the Healthcare Connect Fund, which I'll talk about at length. E-rate is specifically for schools and libraries for the telecom services. And that reimbursement amount is based on the percentage of, free and reduced lunch kids or kids in poverty in a certain area. And that can go anywhere between 20% and 90%. So depending on the level of poverty in a given area, it could be up to 90% off the bill associated with schools and libraries telecom services. The Connected Care pilot program just started last year in the late fall, early winter, and it was $100 million over 3 years. And it was, again, it was to serve the end user, but it wasn't funding directly to the end user. So it was up to 85% off to connect healthcare facilities with their patient populations, though you could not use it for any devices or medical equipment. So you couldn't purchase a phone or an iPad or anything like that to give to the end users. This was a pilot program, so you did have to apply and be awarded. If you didn't already apply, sorry, it's too late, though they are saying they'll likely do another round of the pilot applications. And there was actually one group in Ohio that received some funding, OCHIN, OHCHIN, which has some CMHCs in Cincinnati, and they were awarded part of the Connected Care pilot program, but that was the only one in our 4 states that received anything. The COVID-19 funding, we are now getting ready for a second round of, the first go around, it was, I believe, $200 million, first come, first serve. There are, well, first come, first serve with some requirements that they never made public. So it was very difficult to decide or to tell how they were able to decide who got what funding. For the second round, there are some good things and some bad things. There's more funding. It's going to be $250 million. They have guaranteed that every state and province will get at least one funded application. That was not the case for the first round. And they've also released pretty substantial evaluation metrics, including the scoring for each. So, and we can certainly share that with anybody that's interested in applying for the second round. Shows you what you need to know to put together a great application. The bad thing is that the open window for filing is only going to be 7 days long, so you need to be ready. They are going to give 2 weeks notice whenever that 7 day period will open, but they have not given the notice yet. So keep your eyes open. We will try to alert people as well when we know that window is going to be. That's a very tight turnaround time to submit a strong application. So I suggest you look at those metrics now if you're interested and start putting together your application. And the last thing is the Healthcare Connect Fund. That's the one that we're going to talk about the most. As I said, it's kind of a sister to the E-rate program because it funds all of the same things. It just is for nonprofit healthcare providers. We can go ahead. Let's see. Do I have control back? Nope. Next slide. Here's a couple other programs I'm going to talk about before we jump in real hard to the Healthcare Connect Fund. These are non-FCC programs. The USDA's Rural Development Broadband Reconnect program. They have 3 different ways you can file for this funding, and it's to build infrastructure. So they have grants, loans, and then a combo grant/loan that you can do, and there are different funding amounts for each. The only requirement really is that is for rural development, and also the minimum speeds you can apply to implement are 25 meg down, 3 meg up. So that's the definition they're using for broadband at the USDA. So for the grants, you can apply for $25 million with a 25% match required. For the loans, you can apply for $50 million, and that's a 2% interest on that loan. And these are up to, you can do less than, obviously. And then there's the combo of a grant and a loan where you can get $25 million as a grant and $25 million as a loan and combine that work together. So those are some options through the USDA program. I'm actually going to let Becky talk to you real quick about the RUS.
Sorry, we thought we could be cool and techie, and it's not working the way we anticipated today. So the RUS Distance Learning and Telemedicine program is part of the USDA. These are grants that are available on a rolling basis. Every spring they come out, and they are open right now for applications. There's going to be 2 different webinars, and I will get those links and we'll send them out. Actually, I'll probably have Carolyn send them, make sure that everybody has the links to those 2 webinars with the slides. We will post the slides and the audio from today and the archived webinars portion of the UMTRC webpage, and Carolyn will send that out when it's available. But anyway, so next week on April 14th, there'll be a webinar about the application, kind of guiding you through what needs to go into an application. And then Tuesday, April 20th will be another one. I have not participated in any of these DLT programs in several years, so the funding process may have changed. I haven't looked into this year's application. In previous years, it has been very prescriptive, and the more match money that you have, the higher the objective score. Also, it relies a lot upon the rurality of the different locations in the application, and whether or not the local school systems have the percentage of NSLP, so National School Lunch, participants, free and reduced lunches, plays a lot into that objective score. That's what I know on that.
Thanks, Becky. And then my last thing that I want to highlight is specifically for Indiana, but I'm confident that Illinois, Ohio, and Michigan have similar offices and similar commitments to broadband in their states. But our Office of Community and Rural Affairs in Indiana has a Next Level Connections grant program that is specifically to fund and build broadband expansion in Indiana. But it is for specifically identified census blocks. And you can follow that website link I have included there if you're from Indiana and you want to see if any of your local census blocks have been identified. They've not announced funding for 2021, but I suggest keeping your eyes open because I know there is money at the state level for broadband expansion. So we'll just keep our eyes out to see when they announce the Next Level Connections. Next slide.
Allie, there's one other thing I just saw today, and I think I sent it over to Carolyn to put out on the news section of the UMTRC website that is for a new broadband program in Ohio. So we'll make sure everybody gets that as well.
Great. So as promised, we're going to do a deep dive, though I see we have 9 minutes left. So when I say deep dive, we're going to fly on the Rural Healthcare Pilot Program, which became the Healthcare Connect Fund. So the pilot program began in 2009. It was specifically for nonprofit rural healthcare providers. I've listed off all the designations there: rural health clinics, community mental health centers, federally qualified health centers, community health centers, especially serving migrants that were eligible, and of course our rural hospitals. You got up to 85% in reimbursement for your telecom services under that program. And you had to be approved as a pilot provider. It was not open to just everybody. And that's where the Indiana Telehealth Network was launched. There were 62 programs funded in the nation. We were one of them. We got $16 million and had 72 participants that we worked with initially under the pilot program. Next. The pilot program sunset 2012 into 2013 and became the Rural Healthcare Connect Fund. Most of the rules are the same, other than you did not have to be approved as a pilot or a consortium in the state. Individuals and other consortiums were now allowed to start. You had to still be rural, but if you participated in a consortium that had at least 51% designation rural, you could have non-rural entities come in too. So if you were a group of community mental health centers that had, and I'll just use in Indiana, of course, 8 rural sites around the state and an admin office and a data center in Indianapolis, you would still be fine because you would have 8 rural and 2 non-rural. There may be some change to that percentage rural designation. They have hinted at USAC that if we start hitting our funding cap consistently, they may raise the number of rural required participants in a consortium, but nothing has been stated concretely yet. You still have to be nonprofit. You cannot be anything other than nonprofit or government entity to get these funding opportunities. And it was all the same designations that were eligible, but 2-3 years ago, almost now, they added skilled nursing facilities as eligible entities. Again, have to be nonprofit, because I know there are a lot of for-profit nursing facilities and retirement communities, things like that. But the reimbursement rate was also lowered to 65%, still pretty darn good, but not quite as good as 85%. And then I mentioned the funding caps. If we do exceed the funding cap, if there are more requests than there are dollars, they will prorate the amount down from 65%. And this year they actually started, and I have messed the slide up apparently because there's actually an 8th level now too. I need to update that. There's tiered levels 1 through 8 that make you eligible for the funding and for the proration. And essentially the way that works is if we hit the funding cap, they will fund sites 1 first, 2 second, 3, and so on, up all the way as far as they can until they run out of dollars. And then whatever level they're at, they will prorate. So if there's only a small difference between the ask and the dollars, they would prorate only level 8 to some percentage. Hopefully that's not too confusing. Happy to answer questions on that. And it starts as rural, medically underserved. That's tier 1, all the way up through tier 8, which is non-rural, non-medically underserved. And there are extremely rural, medically underserved. And there are little designations for each, which I can also talk about if people have questions. And the ITN has grown to work with over 300 different healthcare providers at this point. And I had done the math recently, how many dollars we have brought into the state, over $26 million now that we have put out to our participants. And that's not including last year's applications or this year's application. So it's probably closer to 30 by this point. So yeah, quite a few dollars through this program, just through the Indiana Telehealth Network.
That's awesome.
Next slide. So this is, I'm going to go through this so quick. I know I've said that a couple times, but this is the steps that have to be taken to apply for the Healthcare Connect Fund. Your first is Form 460, where you determine each individual site's eligibility. Quite a bit goes into that. You have to have all of your licensure. You have to have contact people at your organization, at your physical site, et cetera, et cetera. But it determines both your eligibility to participate in the program and your rurality and your tier level. Once that is approved, you go into a Form 461, which releases a request for proposal to the street. You must take bids for any services, even if you have an incumbent provider that you love. It is a rule of the Healthcare Connect Fund that you have to take it open and have a fair and open bidding process for anybody that is interested in supplying services to you. And that's something that's done by USAC as well. They review each and every RFP that comes in, and you have to meet all of those requirements. You have to leave it open for 28 days, etc. So if you make it through that point, you've got bids now. Then you do a Form 462, which is a massive spreadsheet where you submit line item by line item, every service at every site. You are asking for different, it could be construction, it can be installation, and then it can be the monthly recurring services associated with broadband. So that basically just determines the eligibility of services you are requesting. And then there is the Form 463. Once you get your Form 462 approved, you get a funding commitment letter, which allows you to start filing for your reimbursement. The Form 463 is submitted with the associated invoices that you received for the services. You have to show that you have paid your percentage, 35% on up. And once that is approved by both you and your vendor has to approve it as well, the funding is then sent out. And then record keeping and audits. You have to keep every document, even email conversations you have with vendors for 5 years after the last date of service or the last day of reimbursement that is sent out. So you have to keep lots and lots of records. And then you are subject to audits from USAC, which are called PQA audits. And they didn't used to do these, but for the last 3 years, they have done, it's not an if, but a when. And you will get multiple PQA audits, which are pretty extensive. So just something to be aware of. And then for more information, I included the link there where you can see more from the USAC website about the Healthcare Connect Fund program. Next slide. Here's our contact information. We've got 2 minutes, but if we need to stay on a little bit longer, we can. I know I threw a lot at you, and I know Becky threw a lot at you. So if there are any questions about anything we presented today, we will do our best to answer them or find the answer and get back to you.
Thank you, Allie, very much. One question to start us off, and then I'm going to go look for some links for us to put into the chat and to go into our follow-up email. The urban-rural differential for the telecom program under USAC. I've seen some emails, some notices lately that they're not going to make you use the sheet that has static numbers. Can you explain?
Yeah, the rate sheet that USAC had developed with the FCC. There were some kind of funny numbers popping up on that, including especially in Alaska, where it was showing that the urban costs were more expensive than the rural costs. And it was really throwing the urban rural rate sheet out of whack. And frankly, I don't work in the telecom program that much. So I'm just giving you my best estimation of what was going on to cause the problems. But they were extensive enough that the FCC has, for the current funding window, waived that rate sheet. It's not going to be used, the hard rate sheet. There still will be an urban-rural differential, but it will be determined by each individual area instead of the national rate sheet. And I expect that waiver to only last this very brief period. I would not expect it to be long-term. They're very proud and they've worked hard to get that rate sheet together, but just some funky things going on made it invalid for the time being.
Yeah, I know, like a long time ago, I had done some work in the telecom program, and it was hard to find the population areas that they wanted you to, and then a carrier, a telecommunication vendor that would give you a price without an address for a specific location. They don't. It's not something that they're like asking you to put the crust back on the bread or something.
Yeah, there were some flaws, especially in the early days, which is why they tried to put the rate sheet together, and it just didn't work out for every area. Some places it's probably spot on, but when you try to do that for the whole country, it gets pretty tricky. And then you also get quotes from some vendors that's like, okay, that's your quote, but in practice, that would not be the cost.
Right.
So
Mm-hmm. Yeah. All right. So I'm starting to put some of these links in that we talked about in the chat. What questions can we answer for you guys in the couple of minutes we're going over here? You guys are a quiet group.
we've just done too beautiful of a job. Next time we'll leave some things out.
All right. We'll get the rest of the links into a follow-up email, and then look sometime next week for the slides and everything to be available, and the recording on the website. All right. Thank you, everyone. Have a great weekend.